125,000 staff and volunteers make up the Victorian Emergency Services workforce. It is a high-risk industry with exposure to traumatic events and stress due to job demands. A recent Beyond Blue study of police and emergency service personnel across Australia showed that frontline workers have more than twice the rate of psychological distress, mental health conditions, and suicidal thoughts than the general population. It also found that poor workplace practices and culture were as damaging to mental health as exposure to violent and traumatic incidents. The report concludes that a supportive work culture is like giving everyone in the organisation a mental health inoculation. WorkSafe or WorkWell have supported the Emergency Services Foundation to bring together wellbeing managers of 14 Victorian emergency management organisations. They have formed the ESF Learning Network to address the mental health challenges shared by the sector. The Learning Network determined that improving how leaders are developed, not executives, but specifically people who lead teams, will best address a range of workplace risk factors.
Team leaders in emergency services organisations can have a really important role in terms of mental health and wellbeing. They're the ones that set tasks on a day-to-day basis. They help to set the tone and culture of a workplace, and also because they have a chance to get to know their team members so well, they can notice if there are changes happening and hopefully assist the member to get early intervention and support as required.
A new way of developing team leaders is required. The Learning Network saw an opportunity to drive innovation and consistency for sector-wide impact by working collaboratively on this shared challenge. Through a process of co-design, we created a development program for team leaders, Leading for Better Mental Health. Leading for Better Mental Health was designed by listening to team leaders and talking with subject matter experts. This was combined with understanding what is happening now using a sector-wide scan of major inquiries and current leadership and mental health training programs and research. Leading for Better Mental Health involves participants working to address real mental health leadership challenges as individuals and teams. It is designed to help team leaders understand workplace risk factors, recognise their impact on others, confidently lead with a focus on creating a mentally healthy workplace. There are 4 main features that set this program apart and gear it for success. 1. It takes a sector-wide approach that brings staff and volunteers together from different agencies. This has never been done before. 2. It uses mentoring, coaching, and peer-to-peer reflection to develop personal insight and test new leadership approaches. 3. It is skill-based and practical, with an emphasis on application in the workplace. The program provides time and space to reflect on new ways of leading. 4. It will bring CEOs into the conversation with team leaders about barriers to leading for better mental health so systematic change can happen.
The benefit for the leadership pilot is the access to the experts in the field that they wouldn't otherwise get access to.
What's unique about the leadership pilot is that volunteers and paid employees can actually learn together, they can come together, they can actually grow their skills in leadership and share their experiences, really valued as one.
This pilot will involve participants from 12 agencies. It will be delivered online by leadership and mental health experts from March to September 2021. The program quality, content and delivery will be evaluated, as well as the difference it makes to leaders and their teams. For more information about the project, visit esf.com.au/services/learning network.